exhausting,
disabling,
pain,
invisible,
debilitating,
incurable,
chronic,
frustration,
life impacting,
isolation.
I am 1 in 10.
My name is Clodagh Lynam and I'm chair of the Endometriosis Association of Ireland.
What is endometriosis?
Internationally, it is estimated that about around 1 in 10 people who are assigned female at birth have endometriosis. It's tissue that's like the endometrium. It's like the endometrium is the lining of the womb. And so tissue that's like the lining of the womb implants in other parts of the body, usually around your reproductive organs. But it can affect other pelvic organs, bowel, bladder, even sciatic nerve or urethra. Your diaphragm can be affected. It can affect other parts of the body, like the lungs. It's even been found in somebody's brain. It starts affecting people from their first period. So that means in Ireland, there are around 150,000 people affected or more.
What are the symptoms of endometriosis?
Symptoms of endometriosis include heavy bleeding with the period and also painful periods. Bleeding can occur between periods as well. Chronic pain in the pelvic region, which is not tied to the period. Lower back pain, pain with ovulation, so in mid-cycle. Also bowel pain and other bowel issues. If the bowel is affected by endometriosis, pain on urination, painful sex, which is one that's very hard for people to talk about. Nausea is another one, chronic fatigue, and fever with menstruation is another symptom. One result of endometriosis, one of the things that happens with endometriosis is a loss of fertility. And around 30% of people with endometriosis find it very difficult to conceive. And the longer it's undiagnosed, the more damage can be done during that time. Not wanting to scare anybody, but this is why it's really important to get a diagnosis as early as possible.
My name is Erin Carolan and I'm nearly 24. I was diagnosed with endometriosis in September of 2019. My symptoms would have started when I was about 12 maybe. A lot of pelvic pain and my periods are really, really bad. The first time I really knew something was wrong was when I was away. I was in Tirana, we were in Berlin, and I was in the bathroom crying with pain. So that was a big eye-opener to me that something needs to change, something needs to happen, something's not right. So when I came home, I went to the GP and had an ultrasound and nothing showed up on the ultrasound. That went on for a couple of years, back and forth to the doctor, painkillers. It's just a period pain, it's normal, it's supposed to be sore. And then I was referred to see a gynecologist. I went to see them and they said, it doesn't sound like endometriosis, but, you should get the coil and see if that does anything, if that helps. So then when they spoke to the consultant, he decided, actually, no, she needs to have a laparoscopy to see if there's any endometriosis there, and lo and behold, there was. So after being dismissed and being told there was nothing there, it was normal to have painful periods, then to go and have surgery and to be told there was something was a huge relief.
How is endometriosis diagnosed?
Diagnosis of endometriosis is quite difficult, actually. There can be a very long wait time for a diagnosis. The figure of 9 years in Ireland as an average has been put about. Sometimes endometriosis can be diagnosed with scans, but until a laparoscopy is performed, which is keyhole surgery. So basically the surgeon gets to look through a very tiny hole, to look inside your pelvic region, and they can look at the endometriosis and identify it that way and do a biopsy. But it's still invasive. For most practical purposes, the laparoscopy is still considered to be the most reliable.
What treatment options are available?
Treatments fall into basically two categories. One is a hormonal treatment and the other is surgery. If a person is not trying to conceive, the pill can be offered as a treatment for the symptoms of endometriosis. So it doesn't tackle the disease as such, but it helps to dampen down the symptoms. There's a group of drugs called GnRH agonists, which put you into temporary mini menopause. Traditionally, I suppose what a surgeon would do, they'd do a laparoscopy and carry out surgery. So they'd do a process called ablation, which is where they kind of burn off the lesions, burn off the endometriosis lesions. And they'd also separate adhesions. So adhesions happen when two parts of your internal, your body inside get glued together that shouldn't be. Excision has been favored by a lot of doctors. Excision actually takes out the endometriosis lesion, and seemingly it's less likely then to grow back, because people who have ablation treatment, very often the endometriosis comes back, whereas excision seems to be better at ensuring that it doesn't come back.
An endometriosis flare-up is a sudden worsening of symptoms which can happen at any time of the month.
When I have a flare-up, I have a few things that I like to go to. So my first would be heat. I have an electric heat pad that I got on Amazon. You just plug it in and pop on whichever setting you want, and there's a timer on it as well. I find that quite handy because sometimes I fall asleep, but it will turn off after a certain amount of time. Then I go to medication next. If the heat doesn't quite do it, I'll take some painkillers. So then third would be, there's a brand called BU, and they do kind of a couple of different period products. So they have patches that are like adhesive and they stick on to whichever part of your body you need them. And they have like menthol and stuff, so it's quite calming and cooling, and it just kind of, I think it more so distracts your body and messes with your signals in your head and stops the pain somehow. They do CBD rub as well and bath bombs and stuff, but the patches I find the most helpful. And I suppose my last one kind of ties back in with heat, but it would be like a really, really warm shower. And I just let the shower run on like either my back, if it's my back that's hurting me, or like my tummy, and just let the warm water run.
Who are the Endometriosis Association of Ireland?
It's an entirely volunteer-run organisation. It's really important for people with endometriosis to be able to meet up with others. We have an information day once a year. We've managed to keep that going under COVID online. The Endometriosis Association of Ireland decided this year that what we are pushing for is more awareness so as to bring down the delay time in diagnosis.
If you're experiencing any of these symptoms during or outside of your period, please contact your GP.